My name is Ariel Childs, and this is Vital Connections. Boston presents a paradox. Our city is resource-rich with powerful assets and world-class healthcare, yet historical disinvestment and structural racism continue to drive persistent health inequities. BIPOC and low-income residents face higher rates of chronic illness, and in just 2 miles between Boston's Back Bay and Roxbury, there is a 23-year gap in life expectancy. In 2023, Massachusetts hospitals and HMOs invested $1.2 billion in community benefits, a fraction of health equity funding. And that same year, health inequities cost our state $5.9 billion due to avoidable healthcare expenditures, lost labor, and premature death. Each of these numbers represents a life lost, a family impacted, and a community left behind. Resources are pouring into a leaky bucket, rarely reaching the people who need them most. I've seen this leaky bucket firsthand while leading maternal health equity programs at a major Boston hospital. One-sided partnerships and misallocated resources led to fragmented care and unmet social needs. Families were forced to chase support across the city, while Band-Aid fixes failed to address the root cause of their poor health outcomes. And after enormous investment, racial inequities in maternal health saw little to no improvement in over 30 years. That's why I joined Vital Connections. We are repairing the fragmented healthcare system by building vital connections among neighbors, organizations, and sectors. Our community-led systems change model transforms inequitable systemic conditions that undermine our local community health ecosystem. Our model has 4 stages: assess, convene, cultivate, and sustain. We start by assessing existing community assets and identifying the challenges that residents care most about. Next, we convene stakeholders, co-designing cross-sector strategies that leverage existing resources but connect them in new ways. Every step of the way, we cultivate community ownership, shifting power to residents as leaders and decision makers, creating pathways for employment and community stewardship. And lastly, after demonstrating success, we align our grassroots efforts with upstream resources, systems-level resources, to sustain our long-term impact. Our model creates an ecosystem that allocates resources equitably, fosters collaboration and community stewardship, and embraces a holistic vision for health, advancing health equity for all. Now, real change moves at the speed of trust, and yet we all know here that change cannot wait. That's why we apply our model to immediate on-the-ground needs while working upstream for lasting systemic reform. Our model tackles 5 community priorities, including food access, community-based wellness, maternal health, long COVID, and mental health. I'm going to start by sharing some of our maternal health work. We are spreading information about diverse birth options proven to improve maternal health, like doulas, birth centers, midwifery care, and ensuring that these services respond directly to community voice needs and priorities. We're making maternal health a kitchen table topic, engaging everybody from educators to abuelas to teen boys. Now, as you can imagine, teen boys were a little bit apprehensive about joining this conversation. Not a shock. However, through the power of music, finding and writing lyrics that reflected their own stories of origin and their vision for liberated birth, they found their voice too. And for Brandon, who had supported many births in his family, that meant he finally saw himself as part of the change his community needed. We're also tackling Boston's food insecurity crisis through the Neighborhood Food Action Collaborative, convening over 30 organizations and 50 community members to advance food access across Boston. In 2024, the Collaborative's mutual aid groups distributed over 300,000 pounds of food to families in need, with almost half of that diverted from landfills via food rescue efforts. And in just 5 months, our peer advocates connected 2,000 residents to local food resources. In terms of our 2024 social impact, our partners report increased connections to their target communities and improved collaborations with one another. So to sustain these gains, we invested $100,000 into our network of 80 partnering organizations and 40 paid community members who together facilitated 19,000 community health connections, linking residents to essential services, resources, and health education. I joined Vital Connections in 2022 as the ED, and since then, our budget has grown from $400,000 to over $1 million. Our team has grown from 3 to 9, And the National Network of Public Health Institutes named our model a national best practice and partnered with the CDC to share it nationwide. And yet the work has just begun. So today, to deepen our impact, we are seeking an investment of $3 million over 2 years to help us expand our capacity, grow our community leadership pathways, and scale our proven model. Let's finally repair Boston's leaky bucket and build a healthier future for everyone in our community. Thank you.